Hello everybody, this is Dr. Zhang from Roselle Center for Healing. Today I'll talk about the finding relief after failed spinal surgery. Okay, we talk about that. I want to tell you guys. So I have in this presentation, I have 4 topics. The number 1 is definition of the failed back surgery syndrome, aka FBSS. So the second one is why FBSS happened. So we want to know the reason, what happened, why. So the third one will be talk about the treatment options. So the treatment not only after the surgery, how can we approach that from natural way, conservative way to make your life better, make the symptoms go away, and then from the cause, from the root, we can treat the problems. And the last one will be the tape. So I'll tell you guys some tapes you can do at home to help your body help your body get well. Okay. So third one is the definition of the failed back surgery syndrome. So with aka FBSS. So after spine surgery, so everybody expecting your back or neck as problem to be resolved, but sometimes that doesn't happen. So whether immediately or months after surgery, the procedure, the pain, and other symptoms may return. The phenomenon known as failed back surgery syndrome. This is called the FBSS. So having failed back surgery, that does not suggest you or your surgery have failed. That means you can tell it's pretty common. So it's not uncommon. So manufacturers that lead to FBSS are out of control. Sometimes cannot control. Sometimes you do. Sometimes you can control. So before we talk about the spinal surgery, I want to talk about some low back pain. From statistics, so what we can say. From NIH states that 80% of all people experience the back pain sometime during their life. So this is very common. It's very, very common. And also, the second most common reason for the visit to the primary, doctor behind the breathing problem, respiratory, the infections is low back pain. It's low back pain too. So that's why you can tell it's so common. One of the most common causes is causes of missed work time. Okay, so 50% of working Americans admit to having low back pain each year. So Americans spend $50 billion a year on low back pain. Okay, so all the statistics, then you can tell low back pain is very, very common. Low back pain can affect your life definitely. Low back pain can definitely cause a lot of damage, not only physically, but also financially too. So the statistics from Johns Hopkins. So this is 50,000 people have spinal surgery a year, costing $11 billion. It's fewer than 5% of people with spinal pain are good people to candidates for surgery. And 80% of people with disc herniation get better with the time. So 30% of all disc accidents or laminectomy provide relief. There's only 20% of all spinal fusions are failures. 20% of all spinal fusions are failures. So from these numbers, you can tell. So this it happens very often after spinal surgery. All right. So for the low back pain, there's a different kinds of low back pain. One is acute low back pain, one is the chronic low back pain. So if the low back pain lasting less than 2 months, of duration, is the quality that consists of the sharp, burning, stabbing, or localized, or dull pain, or the achy, So the intensity is most commonly severe. It happens less than 2 months. What we consider is the low back pain is acute pain. So if the pain goes over 2 months, it becomes sore, achy, generalized. There's more intensity is most common dull in this area. So this stage we consider as chronic pain. It's chronic pain. The pain generators in the body is by area. So different area has different pain. Different pain can be different areas. So the localized is more cartilage problems, more ligament problems, more tendon issues, and muscle irritation and cause pain too. And if the pain is more distributional, it be nerve irritation too. Nerve, if the spine, it's misalignment spine cause the patient nerve cause nerve irritation. If you have disc herniation, cause nerve irritation, also can cause distributional pain too. So the global pain is more metabolic instability or medicine side effects or chronic infections. This includes Lyme's disease and Candida. It's all this kind of global pain, the whole body pain. So another most common reason called the global pain, the body pain, is inflammation. So inflammation can cause by a lot of different things. The most common reason is because the gut inflammation, and then cause a lot of the gut, the leaky gut. There's leak a lot of toxic to the bloodstream, cause inflammation and cause the global the body pain. So another most common reason is the heavy metal. So heavy metals can cause a lot of inflammation and cause the pain in the whole body, right? All right. So the common reasons for the people to go to their doctor to do their consultation with surgeon is the first reason is the unresolved pain. So the chronic or acute, after trial some medications, the pain is still there. So they want to seek for the surgery to resolve the pain. The second reason is the progressive weakness of function related to nerve compression. So they have from the MRI, they do something. The imaging CT, they see their nerve compression, but the compression causes a lot of problems. The muscle weakness, the function is not functional. So if the disc herniation causes the nerve goes to the to innervate your bladder, cause you cannot control the pee. So this also problems that we have. They the people seek for surgery to resolve the problems. The third reason is spinal instability due to the acute trauma, degenerative changes, or the posture, the distortion. Okay, after had a baby, definitely problem too. I have some patient after they had a baby and it caused when the baby is too much trauma for the pelvic, and then causing their low back problems that cause the nerve damage and nerve pain that cause a lot of pain. And posture, if you're sitting too long, if you work on the front deck too long without any stretch, periodic stretch, and it causes pain too. So most common conditions leading to spine surgery, the first one is disc herniation. The second one is spondylosis of the cervical or lumbar spine, as aka arthritis too. The arthritis cause a lot of sperm come out from their spine and pinch a nerve, pinch a vessel, pinch the spinal cord, and cause a lot of numbness or weakness of the body. And then can, leading to spinal surgery can resolve the problems. And cervical myelopathy. Myelopathy is when pressure on the cervical spinal cord causes the compromise the patient's basic functions. The walking difficulty, and the muscle weakness, and the sometimes called paralyzed a little bit. So it's not very just like kind of like the half body, the left arm or right arm or the legs. So this condition is very often related to spondylosis. So the third one is sleep one vertebra of another. It can spondylolisthesis. So it's on the top is that the one vertebrae over another is sleep. It's most common happens for the people have the injury and then sit down, they fell on the concrete, fell on the floor and cause the problem too. It can be diagnosed by the X-rays or the images. So disc herniation. So when we say the disc herniation is an injury to the after you can tell it's a disc here, right? The disc herniation. This is a disc herniation here. The disc herniation here. So the disc between the vertebrae is made up by the fibrous layer of disc and the yellow part inside, and it's just like the egg outside, the egg white, and the yolk inside. So an injury, the out fibrosis layer of the disc is allows the inner layer to protrude. When you have protrude there to the spinal cord, they can compress the spinal nerve and cause the problems. Cause the nerve pain, cause the vessel, it's not enough blood supply, it causes numbness, can cause paralysis too. So the osteophytes, you see here from this images, you can see here in the front, this is the back of the neck, this is the front. And the areas in the new bone grow between two vertebrae. It's most common is because the frictional and the tractional forces. So when you look down for a long time, to the front desk work, the computer work, then they can repetitive move this area, and they can cause the body is very smart. They can tell, okay, it's smart. They can, okay, we have to grow more here to support you. Okay, support you, this osteophytes. So osteophytes or bone spur are protective the mechanism. Actually, it's not a bad things, but how the bad thing is how we can handle this, how we can make you they're used to it, right? So disc degeneration. Disc degeneration is the progressive dehydration and the decreased disc height associated with the loss of spinal curve and the gravitational forces. Okay, so the spine becomes smaller and then the before because this dehydration. This is called degenerative change. Okay. We talk about the disc over spondylolisthesis. So that means this vertebrae goes over and compared to the lower one goes over, right? So the shifting the one vertebrae upon the other most commonly because the trauma or degenerative change instability of the vertebrae level. So when you have this change, then the spine pinches a nerve here, right? Pinches a nerve here. If the nerve goes to your leg or goes to your thigh, you feel numbness in a specific area. So stenosis, the spine stenosis is the spine, spinal cord, in the spinal canal. If a spinal canal is small, it's not whole, it's small enough because spinal stenosis. So reduction in the size of spinal canal or neuronal foramen due to new bone growth or ligamentous hypertrophy. So hypertrophy, that means the ligament is around this area is a lot of ligaments around this ligaments here and ligaments in front too. If this ligament is getting bigger, the whole hypertrophy is bigger, thicker, and then they can make this canal smaller. When you make the canal smaller, and you can tell this from the X-rays or from the CT or MRI, is the canal is being smaller because canal stenosis. Canal stenosis, if there's something, if the disc herniation can cause this canal smaller too. If there's problems, the conventional nerve, again, they cause the pain in a specific area. All right. So some factors that leads to spinal surgery. The first one, primary one, is the trauma or fracture the spine. If you fracture the spine, have a trauma, cause a fracture, you have to do surgery. There's no way you can do conservative, the way to treat that, or the cancer or infection cancer, or excessive sclerosis. It's very bad sclerosis you have to do. It's over 45 or 35 to 45 degrees. You have to do some surgery to correct that. So secondary is DJD, which is degenerative joint disease, can cause that problem too at some points. Stenosis, chronic pain. So it's secondary. But however, all the secondary disease has to do the surgery on, as the answer is no. So the most commonly performed spinal surgical procedures is two categories. The first one is decompression of the neurological structures. So you can tell, we talked about before, just in the few slides before. So all the nerve get a pain to cause the pain. So and stabilizing the spine. When a spine is not stabilized, it's not very stable. So you had to do some surgery to make sure your spine gets stabilized. So if your spine is not stabilized, it's very dangerous because it can shift and go back and forth. It can compress spinal cord. If it can compress your spinal cord, it can cause a lot of the paralysis or nerve pain or numbness, a lot of muscle weakness, all these kind of issues. So the categories are often combined during the spinal procedures. So more specifically, there are 4 common types of procedures that represent about 90% of the all spinal surgery. There's a 4 there. And discectomy, laminectomy, spinal decompression under fusion, anterior cervical discectomy, and fusion. Okay, this is spinal decompression and fusing procedure, specially is performed on the cervical spine. Okay. And the first one is the first one is a discectomy. Is consists of removing a herniated disc material that compress the nerves of the spinal cord, and it is a decompressive type of surgery. So the second one is the opening over the nerve and the spinal cord is performed to relieve the compression of those structures. Lamina is a partial of the spinal cord, the vertebrae. And then when you cut, then you open the canal bigger and can release the nerve or the structure inside the spinal cord. So spinal decompression, the fusion, it is the most common spine surgery performed in the US right now. So it is performed to take pressure on the painted nerve and or the spinal cord to stabilize the spine. So why the FBSS happened actually? So why the failed back surgery syndrome happened? The first reason is the patient was not a good candidate for the surgery that was performed. Okay, so maybe misdiagnosis, maybe. So I talked about on the radio, so the piriformis syndrome or SI problems or the muscle sprain or muscle strain, they can cause pain too. But if you misdiagnosis, they can cause the FBSS. So the second one is inadequate examinations and testing. So there's a lot. There are a lot of, we call it the orthopedic test there to help you diagnosis. So if it is good choice for the patient to do surgery or not. So the procedure causes new symptoms in addition to the existing problems. So when they do the surgery, and then after surgery, they cause another problems beside that. Okay, this can happen too. So the second one is the procedure is procedure complications. So when you do the procedure there, so the damage when you do surgery there, they can damage your nerves or connective tissues there. And then also they can cause the scar tissue after that can cause a problem too. Because when you cut yourself, you can see the scar tissue outside. If you do surgery inside, and also you can tell, you cannot see it, but still the scar tissue inside, it's very hard to recover and hard to absorb too. So the side effects with anesthesia or blood loss altering the precision of the procedure. So the post-surgical infections. Right? So when you do surgery, actually you cannot literally cut out the patient's pain, but only to change the anatomy. But same thing again, anatomical lesion, injury is not proper cause the low back pain, right? No, maybe not the proper reason cause the back pain, but maybe because the SR joint, maybe because the piriformis syndrome, maybe only because the sprain or strain the muscle, right? So we have to do the right diagnosis before to surgery, cause the problem, scar tissue, and compress the nerve root. Okay, so inadequate the decompression affecting the nerve or nerves, and post-operative the infection we talked about before already. All right. Okay, decompress the structures involved. Right, so decompress that and minimize the inflammation. We have to find the ways that inflammation can form. Then we can treat the cause. Then to reverse the symptoms, we have control, remove the scar tissue. We have different ways to do that too. We prevent the collateral damage and maintain the biomechanics of the spine, strengthen the core muscles, make the spine get stronger, and the spine, if the spine is stronger, is more stabilized, and then you have no nerve issue problems. So improve your ergonomics, the posture, stabilize the physiology. Okay, so the clinical assessment of the injury, the part is the pain area, the range of motion and temperature. Okay, and orthopedic and the neurological testing. So we have performed enough or proper orthopedic and neurological testing to see how we can correct the reverse the cause, then to resolve the symptoms, to release the pain, to have the patient feel better. We also do the posture and the gait analysis. If you have a spine, your spine holds you the half body. If you don't have the spine doesn't work themselves. They work with the pelvic, they work with the knee and the ankle and the foot. They all work together. So from the gait analysis, we can tell how your spine works and how your pelvic works. Okay, the posture analysis. So the chiropractic, the spinal examination. So we have check your spine from the chiropractic side, the perspective, and also we have do the evaluation from applied kinesiology standpoint. We test the muscle, we test the muscle work, we test the muscle function to see what we can do for the patient, for you and for the patient. So laboratory or functional testing, we can test if you're an infection or not. We can test the CRP, we can test the CSR, to test the inflammation level. So we can do, okay? And the current management strategies for the FBSS is, so the additional, the procedures they can do, the epidural injections, or long-term painkiller, opioid, use nerve blocks, spinal cord stimulators, or nothing, just rest. It's a current one. It's from medical doctor or orthopedic doctors. From a surgeon, they will tell you the similar things, these things, okay? We will go over very quick. So this is a more medical size, Western medicine doctor. They will tell you do this. But however, from me, so I would do this from chiropractic, acupuncture. Okay, all right. So again, this slide's always there with my my lectures. I say, okay, so keep healthy, do no harm. Okay, keep healthy, do no harm. All right. So you have to increase the immunity and then improve their whole body health. You guys can do better after this. Can have better idea to see how can I approach to spinal surgery or low back pain. So if you have any questions, feel free grab the call or email me at my email on the website. Call my office. So then talk to me. I can call back you to talk to me on the phone. Okay, but last but not least, we do $99 for available tonight to this time only for this lecture. So we do the Holcomb evaluation. If you want to talk to me in person, you want to sit down with me together to talk about how we can approach about your low back pain or after spinal surgery. So from different area, different perspective, I'm a chiropractor and also acupuncturist too. So we can do chiropractic evaluation, consultation, or acupuncture evaluation too. It's only for $99. It doesn't go to everybody else. It goes to the Care for Others for charity. It's tax deductible. Okay. So please, if you have any questions, feel free to call me. Feel free to contact me. I will try my best to make you better and to heal you faster, heal you better. Okay. You deserve live a good quality life. Thank you very much. I hope to see you soon. Bye bye.